Alcohol interferes with the brain's communication pathways, affecting the way the brain looks and works. Alcohol increases the activity of GABA, the brain's major inhibitory neurotransmitter, at the pre- and postsynaptic neuron. Alcohol also affects dopaminergic, serotonergic, and glutamatergic circuits, making it harder for the brain areas controlling balance, memory, speech, and judgment to do their jobs, resulting in a higher likelihood of injuries and other negative outcomes. Long-term heavy drinking causes alterations in the neurons, such as reductions in their size and in brain structures. For example, the reduced overall size of the cerebrum results in placing a strain on the bridging veins. If an individual falls while intoxicated, the bridging veins may break and result in a subdural hematoma. Alcohol is the most common abused substance and is associated with high morbidity and mortality rates. Nearly 2/3 of all Americans drink alcohol occasionally, with 12% of them drinking every day, becoming intoxicated several times a month. Problematic drinking typically begins between the ages of 16 to 30 years old. Men are 3 times more likely to experience alcohol use disorders than women. Alcohol use can be classified as an alcohol use disorder if it leads to clinically significant impairment or distress and is characterized by the following symptoms occurring in a 12-month period. Alcohol is taken in greater amounts than intended, like a person said they would only have 1 drink but ended up drinking more. A person may have a desire to put forth an effort to cut down on use but is unsuccessful. Much time is spent on activities to get or use alcohol or recover from a hangover. Alcohol use impedes fulfilling social obligations of work, school, or home life. Recurrent use in physically dangerous situations, such as driving, tolerance, which a user may need to use more to produce the desired effect, and withdrawal, where an individual begins to feel withdrawal symptoms or needs to drink to alleviate withdrawal symptoms. Withdrawal symptoms are characterized by anxiety, tremors, nausea, and vomiting, which subsides within 5 to 7 days with uncomplicated alcohol withdrawal. Individuals with severe withdrawal may have seizures. They may also experience delirium tremens, which begins 2 to 3 days after drinking, presenting with confusion, agitation, perceptual differences, mild fever, and autonomic hyperarousal. Delirium tremens can be fatal. Alcohol use disorder can cause some of the following health problems: gastritis, diarrhea, peptic ulcers, cirrhosis, and pancreatitis. Individuals may have thiamine deficiency, which can cause reversible Wernicke's encephalopathy, characterized by nystagmus, ataxia, and mental confusion. Wernicke's encephalopathy can progress into Wernicke-Korsakoff syndrome, in which cognitive and memory impairment continues, if not treated with a thiamine injection. Chronic alcohol misuse has been associated with enlarged cerebral ventricles and widened cortical sulci. These effects can be partially reversed if the individual stops drinking. Alcohol use disorders are often chronic conditions, characterized by relapsing and remitting, but benefit from treatments including naltrexone therapy and treatment of comorbid conditions.